Handing over the brochure to Dr. Sri Ramakrishna, the Vice President of National University of Singapore, and Mr. K. Shankar, Joint Commissioner of Police. Thank you, sir. I now invite Dr. Shanti to say a few words about palliative cardiac care service.
Respected dignitaries on the stage, my dear friends and colleagues from Frontier Lifeline Hospital, dear college students and ladies and gentlemen, a very good morning to you all. You may be wondering what is this cardiac palliative care which we are launching today. So I would just say a few words about cardiac palliative care and what is the need for such a care and why we are launching today. Many of you may be aware of the increasing burden caused by the cardiovascular diseases all over the world, especially on the Indian population. And every year there's an increase in number of patients living with chronic end-stage heart failure, which is a burden on the patient, on the family, on the society, disease-wise and financially. What we have to offer to these patients as of now is the treatment module as of now is very disease-specific. And at Frontier Lifeline, we've been taking care of a large number of such patients over the years, and we've come to realize that they have a lot of other issues in addition to the cardiac problems, such those related to the psychological, financial, social difficulties in obtaining jobs, marriage, etc., etc. So treatment module which is very disease specific is not going to help them holistically. So this is where the need for the palliative care comes. What is palliative care? This is the WHO definition, where you provide a care which will improve the quality of life of the patients and the family by preventing the relief of suffering from their distressing symptoms, which starts actually from the day of treatment, day of diagnosis, by appropriate assessment, appropriate treatment, and relief of symptoms, not only those which are physical, but also those which come from the psychosocial and spiritual concerns. So this is what they mean by a holistic comprehensive treatment plan which every patient in the society deserves. How can you provide cardiac palliative care? Practically speaking, it cannot be provided by a single person, either a cardiologist or a physician, because that may not be optimal, because a lot of concerns which have to be dealt with, as mentioned earlier, not only physical. So you need a very good dedicated professionals forming a team, working together to the betterment of the patient. And all of us should realize and understand that the main player in this team is going to be the family of the patient. Because we don't intend to and we don't wish to keep these patients in the hospital forever. They need to go home and lead a life to their best, in their best possible way, for which the family understanding and support is very, very important. So the role of the palliative care team is to educate and train the family to continue the support at home whenever it's possible. The cardiopulmonary team comprises of the cardiologist, who will be the primary caregiver, surgeon when the necessary interventions can be done to improve the clinical status and the condition, anesthetists play a major role in the pain treatment, pulmonologists because majority of the patients have lung issues, nurses who can provide a wonderful supportive nursing care and the support to the family, physiotherapist in making them as mobile as possible and for the symptom relief. The general team, the non-cardiac team, which is equally important in this palliative care, comprises of psychologists who play a very major role in the counseling and support, social workers, spiritual guides, non-allopathic or alternative therapists like acupuncture, ayush, yoga, who can make a big difference in the symptom relief, primary physician who needs to be taught and made aware of such a service so that when the patient goes back home, they can provide and continue the support at home or in the nearby center, and other relevant specialists when and as needed. So all these people working together can definitely make a big difference in the comprehensive care of the patient. So who needs palliative care? The primary physician or the doctor, cardiologist has to decide and agree that this patient needs palliative care, and the patient has to be willing. So this is the main criteria, which is a must. And patients who have at least 2 of these 5 features should and actually need palliative care. They should know that they have a confirmed heart failure, and they have to be in advanced heart failure, anticipated last 12 months of lifespan, at least 3 admissions in 1 year for heart failure, physical and psychological symptoms persisting in spite of your medical management. If they fit under this criteria, they have to be supported by a cardiac palliative care team. So can we make a difference by starting and by doing such service to this patient population? Yes, we can definitely make a difference, because we can relieve the pain and other distressing symptoms. We can integrate the psychological and spiritual needs which are not part of the routine treatment module now. We can improve the quality of life of the patient and the family. We can definitely positively influence the course of the illness, which may worsen if the non-cardiac or non-medical problems are not dealt with. We can let the patients live as actively as possible until death or until transplant. We can offer the support to the family during the illness and during bereavement, and we can and we should make a team approach to address the needs of the patient and the family. So as of now, we are starting services at Frontier Lifeline, making certain policies and streamlining the services to provide the best of care. But our plan is to establish a separate cardiac palliative care at Frontier Mediville, where in a very peaceful and natural environment, all forms of therapies will be put to use to provide the best possible support to the patient and the family. So I would say few thanking words to Jivodaya Hospice, who's been motivating us and who's given their willingness to support us during our palliative care. And I end my talk by saying let there be light in the tunnel for these patients. Thank you.
Thank you, ma'am. May I request Dr. Mayilvahanan Natarajan to give us the inaugural address.
Respected Dean in Cardiac Surgery, Dr. Cherian, dignitaries on the dais, dignitaries off the dais, guests, faculties, ladies and gentlemen. A very good morning to all of you. I am very happy to meet all of you in this World Heart Event Day. When Dr. Cherian invited me for this program, in spite of the fact that the whole of today and tomorrow I had my commitments, I could not say no, because Dr. Cherian has been a leader and role model for quite a number of doctors for decades. He might not be aware of that, but being in a teaching institute like Government General Hospital and Madras Medical College, for 36 years of my life, I have been following. The guest has come. Welcome, sir, welcome. We have great pleasure in welcoming Mr. Shankar, Joint Commissioner of Police. As I was saying that being in the premier tertiary care hospital in General Hospital, we have always followed whatever Dr. Cherian was doing, and he has been a teacher from a distance. Though you don't have to be close to a teacher, you can always learn from stalwarts like Dr. Cherian, who has been playing an active role in cardiology and cardiac surgery, and I had to change all my programs to be here with you, sir, and I consider it an honor. Epidemiologists and international agencies, such as the WHO, have been sounding an alarm for the rapidly rising burdens of cardiovascular disease in India for the past 15 years. An estimated 70 million cases will make India the world's cardiovascular disease capital by 2025. Having originated in the care of those with cancer, palliative care has now expanded to include the care of all individuals affected by life-limiting conditions, including cardiac diseases. Palliative care provides care in the relief of pain and other distressing symptoms, affirms life, and regards dying as a normal process. Intends neither to hasten nor postpone death, and offers a support system to help patients live as actively as possible with a good quality of life until they die. This holistic approach was so far unavailable in India for cardiac diseases. And I congratulate the dedicated team of professionals at the Frontier Lifeline Hospitals under the leadership of Dr. Cherian for having started the cardiac palliative care facility in Chennai. Although mortality is high in patients with severe and end-stage cardiac disease, an increasing number of patients now live for many years following the diagnosis, reflecting improvements in pharmacological, device and cardiac surgical interventions. Combined with the changing demography, this improved survivorship will serve to increase the number of patients requiring palliative care. With the introduction of such care by an institution such as Frontier Lifeline, the term palliative care, which has long been synonymous with the support of those affected by advanced incurable malignancy, will now increase awareness amongst the medical fraternity in cardiac and related health services. I appreciate the Frontier Hospitals Group for utilizing this platform for promoting organ donation awareness. They are always at the forefront in educating and enhancing the knowledge on the need and demand for organ donation in our part of our country. I once again appreciate the organizers for the conduct of this event, wish them a grand success, and have great pleasure in opening the cardiac palliative care services here. Thank you.
Thank you, sir. I now request our Chairman, Dr. K.M. Cherian, to present Mr. K. Shankar with the bouquet. I also request our Chairman to present a bouquet for Mr. Julius Christopher, Inspector of Police Traffic. Please come up to the dais. Mr. Bhaskar, Transport Staff, Police Department. Mr. Balasubramaniam, Inspector Police. Thank you, sir. Chennai to Nellore is 140 kilometers. We are proud to have a beautiful highway, NH5. It is being converted into a 6-lane traffic. We are fortunate to have this beautiful highway. At the same time, we are unfortunate that we do not have an emergency center, which is a must for a highway. Mr. Ravindra Shannareddy, CEO and Managing Director of SriCity, the largest SEZ zone in South India, which is our close neighbor, has graciously consented to inaugurate the Trauma, Accident and Emergency Care Ambulance. I now invite Mr. Ravindra Shannareddy to graciously inaugurate. And say a few words.
Other dignitaries on the dais and our Dr. Cherian and other dignitaries of the dais. A very good morning to all of you. I am really very happy to be here not as a CEO of the Sri City, but more as a heart patient. I don't think many of you will realize that I had a bypass about 10 years back. So I'm really, really very happy to be part of this heart day, because I am the not only what you call, I'm a beneficiary of all the good work that is being done by people like Dr. Cherian. And I used to live in US, and I was in IT. Probably that is what contributed to an extent the stress and other things. Fortunately, I found the disease and had the bypass. I moved back to India. And when I moved back to India, we wanted to develop an area that I grew up into a world-class city, so that a lot of people like us who have studied in India, went for abroad for higher studies or jobs, when they come back, a lot of us found that the environment that we live here is not as clean as some of the things that West. And medical facilities, school facilities are not in par with world-class standards. So we, group of us, started thinking, how do we develop a new age world-class city next to Chennai? Because I grew up in a town called Sulurpet, which is very close to where Dr. Cherian is building the world-class hospital, and also where we are doing the project. So in that journey, we started looking at however Hosur got developed using Bangalore, or Shenzhen got developed using Hong Kong strength. Why can't we develop the border areas of Andhra Pradesh, which had all the potential for growth, but was ignored by the government, successive governments in Andhra Pradesh, because this falls at the, we are very far from the state capital, Hyderabad. So we approached the government. They were very happy to develop that area. So we were very, very successful in getting, which is very hotly debated commodity now, that is the land. There is national land acquisition policy being debated. However, the people there wanted these kind of facilities. This is the constituency which didn't have a degree college even 60 years after independence. That is how backward that was, and still it is only 55 kilometers from Chennai. So there was a huge difference between the Tamil Nadu villages on